with us Dr. Umesh Banakar, Professor and President of Banakar Consulting Services, who is also the guest speaker in the seminar of Intellectual Property Rights Career in IP. We will have a quick chat with him regarding some pharmaceutical issues. Hello, sir.
Hi.
So, currently, in the field of clinical trials, why is India lagging behind?
Actually, India is not lagging behind. It could do more because significant clinical trials in particular in oncology, India is number 1 or 2. Oncology is for cancer. Okay. There are CROs in India which do clinical trials for submission to US. The big ones like the Quintiles and the Icons, and those are here, probably they are the ones where the competition is very tough. And that's where number-wise the Indian CROs versus MNC CROs, that's where the difference, I think it is misrepresented that less number of trials are in India. Number 2 is the clinical profession is getting more and more recognized, where once we improve or get better in our clinical pharmacy aspect of the pharmacy program, it will be even more. So in both situations, actually, clinical trials in India for Indian companies as well as international companies is fairly significant. But yes, we could do more.
What should the pharmacy students keep in mind before publishing their research work?
2 things. Number 1 is I'm now getting into intellectual property rights because that's where this big confusion is. There is this whole aspect about publish or perish, which everyone is talking about. Why? Because there is a misunderstanding that, if we publish something from our research work, then we cannot patent it or get an IPR on it. But that's where that misconception has to be removed, because there is something known as a 1-year period, where from the date you file your application for patent, 1 year prior to that, if you have your work published, is not going to be considered against you or as prior art. So once anyone understands that, then publish or perish will not matter, because you can publish, you can submit a manuscript for publication as long as it is within 12 months prior to the date of filing of patent, number 1. Number 2, the first thing that I would generally recommend is, once the research project is complete, get it assessed for whether there is an invention in it. For that, you do not need to spend money, you do not need to engage anyone, you can do it yourself because it is your own work. Okay? And I don't need somebody else to come and tell me that I have an invention in my work. Okay? So that's the one thing that we have to start getting trained on, how to assess that. And that has to become a required component. Completing a project, get it assessed for whether there is an invention in it. And number 3, most critical, is first go for filing. Once you have an invention in your hand, first go for filing. Get the date stamped from the patent office, so that now you can get a claim, and now you can publish. So then you will have that in your favor.
Thank you so much.
Good luck. Thanks.